because we don't have a healthcare system in this country. We got the best doctors, best hospitals, best clinics, best technology, best medicine, best everything, but the worst system.
Democratic Visions is handmade in Eden Prairie and Minnetonka by DFL Senate District 42.
Healthcare debate raged in Washington seemingly for eons, but finally President Obama signed the legislation into effect. Truly a landmark bill. And now the Tea Party and certain partisan Republicans want to repeal this legislation. Our guest tonight is John Marty. John is truly an expert in healthcare, and we're going to get into a discussion of what the effect of the national legislation has on John's proposal for statewide legislation in just a minute. But first, John, welcome to the program.
Thank you, Tim. Glad to be with you again.
And I want to talk about your choice for Lieutenant Governor, Patricia Torres-Ray. Tell us a little bit about her.
Well, she's a state senator from Minneapolis. I've been in the Senate for only 4 years, but she's got lots of executive experience. She's a dynamo. I'm very excited about her. First of all, she connects very well with people. She brings in people who have never been involved in the political process, gives them a sense that government is for them. She understands my vision for how the state can provide health care for everyone. She's very big on education, making sure every kid gets a good education. And so I'm really honored to have her as part of the ticket.
John, when you were on this program well, just a little bit over a year ago, you and I talked about the Minnesota Health Act. Does that have continued relevance in view of the fact that we now have national legislation which adds 32 million people to the ranks of the insured, or will add 32 million to the ranks of the insured, addresses the problem with pre-existing conditions, allows youth to remain on their parents' policies until they're 26 years old, provides for credits to employers if they provide health insurance? I mean, that's a pretty big movement on the national level, is it not?
It's a phenomenal step forward at the national level. It really changes things. You have to recognize how big the problem was and recognize it's a big step forward. It doesn't change at all our efforts because, one, I think what it shows is you can accomplish something. Two, it makes forward progress, but it doesn't get to the goal line. We want to get the rest of the way to the goal line.
What's the goal line?
Goal line is making sure that everybody has health care.
So instead of having 94% of the country insured after this legislation takes full effect, you want 100%?
Yes, universal health care, when people say 94% universal in the same sentence, I don't see an equal sign between them. And I think it's reasonable to expect that 100% of the people have health care, and to do so in a way that brings down costs and improves health. Part of the difference, I guess the way I'd phrase it, is that what they're doing in Washington, while a big step forward, still focuses on an insurance model. Healthcare is something that somebody ought to have a right to, like police and fire. It's something you don't have to qualify for. You don't have to prove you're eligible. And I think healthcare is important like that everybody should have it. Insurance is important for if you have a big house or a small house or any size house. You need it to protect against fire, against theft, against all sorts of things. You need insurance for a lot of things, but for healthcare, it's something that everybody needs. And the people who need it most are usually the least able to afford it. And the other problem with the insurance system is it doesn't cover everything. You know, if in Massachusetts they've had the same sort of thing for several years now, and where everybody's supposed to buy insurance. If you can't afford it, they'll subsidize it. But the trouble with that is if your problem is rotten teeth and your plan doesn't cover dental care, it doesn't help you. And there always are gaps in the system.
Your plan would extend to virtually everything except cosmetic?
Right. That's a good way to phrase it. Almost everything you can think of. It includes long-term care, includes prescription drugs, includes dental and eye care, includes mental health and chemical dependency treatment. And I think the bottom line is I put together 9 principles that we designed the Minnesota Health Plan around. Covers everyone, covers everything. The patient has the choice of the doctor, hospital, clinic. Focus on prevention, not denial of care to save money. So a whole range of things. In the federal legislation, your introduction was exactly right. You can't say enough about what a difference it makes. 32 million people have coverage that don't have it now. But insurance coverage, again, there are a lot of people in Minnesota who have $5,000, $10,000 deductible policies. A lot of those folks are farmers.
So they probably can't afford to go to the doctor.
Anyway. So insurance does not guarantee you the ability to go to the doctor. That's what we're trying to move beyond that on. But having said that, saying that we have to go further, because frankly I don't think the federal one, it doesn't do enough to bring in costs. We have to contain costs, and our bill actually will save money from day one, and we think it will save a lot of money through preventive health, through negotiation, through a whole range of efficient delivery of things. But so the way I like to say it is the federal legislation was a big step forward, but it's not sufficient.
If we were to enact the Minnesota Health Plan, would we sort of be an island? Would Minnesota be an island? Can we really segue Minnesota's plan into the national plan, or is there just some irreconcilable differences that can't be overcome?
Temporarily, we would be an island. Why do I say that? If we passed Minnesota Health Plan, covering everyone for everything, best thing we could do to help business grow in the state, best thing we could do to balance the state budget, I can get into any of that if you want, but the best thing we could do to help businesses, individuals, school districts pay their bills, best thing we could do for the state is this: if we adopt this, every other state in the country will adopt it within a decade.
But there are a couple of questions. I mean,
Sure.
Can we afford it? How would we finance it?
Sure. Those are good questions. They're key questions because, again, the whole thing in Washington, they mentioned very clearly that the new health reform will bring down the deficit. But
that's challenged. I mean, is it not?
And it's also because they're bringing in new revenue to do that. Our bill, we think, would be about 20% cheaper over what we spend now. And I think that's critically important for that reason alone. It's not an easy thing. It would be the biggest.
But you've got
political
support in
fight.
the legislature, don't you, for
We've
your
got
plan?
a third of the legislature's co-authors. We passed it through 3 committees, but it will be the political fight of our lives. I mean, in effect, healthcare is twice as big of a sector of the economy as the state government is. It's that big of a deal. And to reshape this, because we don't have a healthcare system in this country. We got the best doctors, best hospitals, best clinics, best technology, best medicine, best everything, but the worst system.
So, John, I read that you had a conference with your father, Marty, in dealing with faith. Can you tell us a little bit about that?
Sure. Yeah, my dad's a Lutheran minister and theologian.
Still active?
Still active. He's retired from teaching, but he's still writing a couple books a year, it seems.
You gotta be kidding me.
We heard Glenn Beck, the right-wing commentator, gave a talk, one of his shows a few weeks ago, said, if your church or religious institution talks about social justice, run as fast as you can. And so Dad and I decided to do a father-son conversation on faith, politics, and social justice. We sent this out invitations a week and a half earlier, and not a lot of publicity. We had 500 people.
You got to
show
be kidding me.
And it was at a church in South Minneapolis, Holy Trinity Lutheran Church,
Really?
2,700 something.
Really?
And the Duluth News Tribune got it wrong. There's a Holy Trinity Lutheran Church in Duluth at 2,700 something.
So they had people.
They put a notice up there. We had 40 people show up to the wrong address up there. But it was.
Did they pipe it in?
They should have. We didn't know they did that until we found it later, and we got emails from people saying, "Oh, about 10 of them."
So what was the feedback?
It was wonderful, very positive. A lot of people who have a social justice concern, value, came at it from a faith perspective. So we talked about all of that and the role, what social justice means in politics, and the idea that we're supposed to care about each other.
Sure.
The Paul Wellstone, we all do better when we all do better.
Right.
I mean, I think that really is a good point.
John, lots of luck on your campaign.
Thanks a lot.
Good to see you.